Okay, so just an obvious reminder about the recording, and that we will send it out afterwards. And as Nick just said, please use the chat box, and then we can bring people in for questions. But Claire, if you're happy, if we just hand over to you straight away to do an update, and then hopefully Mike will be joining us as soon as possible.
Yes, absolutely.
Thank you.
Indeed, Pam. First and foremost, I can't say enough about how wonderful it is to see so many of you. So thank you very much indeed, and thanks particularly to Pam for organising this. And hopefully Mike Gogarty, the Director of Public Health, will be joining us. As I say, he was just taking another call and will join us as soon as possible. So first and foremost, can I say very, 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 very well done. I think every week is hard for you. It has been since February, March. I think this is probably the hardest, but I'm sure you're also enjoying seeing all of your staff and all of your children back as well. So it has been a very positive start to the academic year in the most difficult and challenging circumstances. So I can absolutely assure you that is recognised by everybody in terms of the fantastic work that you're doing. The early indications is that attendance levels are exceedingly high, so that we know that the majority of families are back. Not all families are comfortable. I'm still getting some anxious emails from parents myself about it, and I'm sure you're dealing with them as well. But I think I say well done that the majority of your children are back in school during what has been a very difficult time, and we all agree it is the best place for them in terms of their futures. So well done for getting all of that organised, because I don't underestimate the task that you've all had. And I think I put in one of my emails towards the end of term that yes, you know, we are here at County Hall, and I will remain here, as the team will remain, absolutely on hand to support you with whatever you need. Is make those difficult decisions for you, and you've made them and you've taken them, and your school for as many families who want to send their children back, and that is a fantastic achievement, and you and your staff should absolutely really proud of all you've done. I know that it doesn't stop at the end of this week, and no week will be the same, and it is going to you know, be a continuous challenge for you in terms of the situations that you're facing. And I can see the questions coming through the chat. They're the same questions that are coming through the school communications inbox as well, about now how to deal with signs of illness, how to deal with potential symptoms, how to work with Public Health England, and so on and so forth. And Mike Gogarty, the Director of Public Health, will deal with some of that. I think we also sent round in one of the emails an open letter that we wrote that was jointly signed between myself, Mike Gogarty, Councillor David Finch and Councillor Ray Gooding, which was really to talk directly to parents, as we were still getting quite a few parents coming through to us during the summer about their anxieties and their concerns. We were also getting quite a few emails about attendance and what would happen around attendance, and would we potentially issue penalty notices for non-school attendance. And we set out a very clear line in that open letter, and if you haven't seen it, I'll make sure it's included in the communications again on Monday, in the view of, we want you to work with your families who are anxious, and I know many of you are, to ensure that they feel comfortable sending their children back, and I know you've had those conversations, and we absolutely want parents want to send their children back, because that is in the best interest of everybody. But ultimately, if you feel you need to use the sanction of fines, you know your families well, then by all means, you know, the request is there to the authority for us to consider issuing a targeted penalty notice. So I think it's really important that we have that tool available to us in terms of supporting you with your families, particularly where absence levels were not particularly high before the lockdown. So, you know, we really do want to support that as well. But I do want all children to want to come back. And as I say, the majority are. This is the minority that we're dealing with now. So I think the challenges faced this week, and I do need Mike to come in here when he joins us. So I'll sort of start this one off to save the questions, really. And Mike might want to say a bit.
I am here. Sorry, I'm here. Sorry.
Hi, Mike. Hi.
Hi.
Mike might want to say a bit more about this, but access to testing is the thing that's sort of been with us in the last 24, 48 hours. I think it's fair to say that that's not a council, something that the council are in control of, but I've had discussions with Mike and his team this week, and they're certainly working with the NHS to increase access to testing. So please do keep trying to either get tests for your staff or your families if that's what's needed. But we are aware of that and we are trying to influence the system to enable there to be more testing capacity, because that is what is going to make this succeed, particularly for your staff if they require testing or their children require testing. So we are aware of that, and I'm sure that hopefully that will be something that we will be able to report on next week as well. And then I think it's really all about just how we have an education system open whilst we're all living with COVID. And that's the reality of the matter. COVID is still with us, and yet the schools are all fully open, and it's how we manage that, how you manage that, and more importantly, how you go back to your core business, actually, which is attending to the education needs of your children, which I know you're all desperate to get back to. So I'm going to stop there by way of an introduction. I'm going to hand over to Mike, and then we'll aim to stop about 5-ish, Pam, and then probably Mike and I will do a bit of a double act in terms of questions and things like that, if that's okay. So are you okay, Mike?
Yeah, great, thank you. So, I mean, do people want to just me to talk generally for a little bit about the coronavirus and then jump into the specific issues as they affect you, or do you just want to kind of do the specific issues that affect you? I really don't mind. I appreciate the work you're doing, and it's I appreciate it's very difficult for you guys at the moment. So I'll kind of take it your call on it, really.
To be honest, Mike, I think an overview would be really helpful, and
Thank you.
Obviously with reference to Essex and how it's impacting Essex and so on. I think people would really welcome that. Thank you.
Okay, now the only problem I would say is I can talk for England on this, so please gong me off if it's as appropriate, please. I'm going to share the screen as well. No, I'm not, because I've been disabled. Host disabled participant screening sharing.
You can do it now.
It's fab. Okay, thank you. Right, thank you. Can people see that? Can you guys see a screen now?
Yeah.
Okay, super.
Yes, we can, Mike, yes.
Lovely. So basically, very quickly, just want to talk about where we are with the pandemic, the importance of the outbreak plan and test and trace locally, and perhaps a little bit about the wider impacts of coronavirus, but see how we get on. So these are the weekly cases in Essex, going from March right the way through to really the first week of September, although the first week of September data isn't complete here. So basically what you can see really since July, there's definitely been an increase in cases across Essex, and that increase continues. Unfortunately, it continues to accelerate as well. What this equates to in actual numbers is quite low. So what in Essex, I would guess the incidence rate per week, which is how it's usually measured, is so we only know obviously that people come and get tested, but of those who are being tested, probably there are around 10 per 100,000 per week are positive. So 10 per 100,000 a week are positive in Essex. That's about the same as the regional average. It is less than the national average, which is probably now more than 20 per 100,000 per week. So about half the national average, but we are sort of following the line of the national growth. So I think we will see growth. It's just at the moment, East of England and Essex are seeing lower rates of increase than other places in England. This shows the same thing, but in terms of a line graph. This is the national data, and you can see that there's actually been a very marked increase in cases. You can't compare what happened in April here with what's happening now. That's because in April, the only people who got tested were people who went to hospitals and people who were very ill. That changed sort of at the end of May. So the figures between the end of May and up until now in September, that's a reasonable comparison. So you can see that from May, it dropped through June to a lowest level sort of early July, when, funny enough, when lockdown came off and the relaxations in the hospitality industry. And from that time, we've seen an increase really right up to now. And that increase has been in younger people. And I think there's no doubt that that is due to the relaxations of lockdown around the hospitality industry. I think that's key. The other thing to note is actually, while we're talking here at around a rate of 20 per 100,000, that is people who come forward and have testing. Unfortunately, in this country at the moment, the vast majority of people do not come forward and have testing. So one of the battles we're really facing at the moment is people who are getting symptoms are not self-isolating and are not getting tests. Now, I have to say that the poor availability of tests isn't helping us anyway in that at the moment, but certainly probably we're seeing only about 30% of the maximum 30% of the cases who are actually out there. So while our rate in Essex appears to be about 10 per 100,000 per week, it's probably closer to 30, 35 per 100,000 per week. One of the good news stories is care homes, and what we've seen is a big reduction in the number of care home outbreaks. This is Essex data again, but also more importantly, I think the severity of the outbreaks. So we are still seeing a few care home outbreaks, but because of the excellent work of our adult social care colleagues, the NHS locally, particularly the community support, the infection control teams, those infections are not spreading like wildfire in the way they did before. So I'm actually very pleased with the way in which now care homes are being managed, because care homes, you can't really socially distance in a care home. So I think the stuff that's gone on there has been really positive over the last few months. This shows comparative data. Hello? Sorry
to interrupt. Could you just confirm the definition of an outbreak? Is that one case, two cases?
So actually, that's really important because they changed it. So the initial definition of a care home outbreak was 2 or more cases, but it's pretty obvious that if you had one case, you probably had a whole bunch more that weren't being identified. So so in care homes, we would say now that one case would constitute an outbreak. In other areas we're looking at, so for example, in schools, we would not say one case is an outbreak. In businesses where we're looking, we wouldn't say one case is an outbreak. So it is varying from place to place, but usually it would be 2 or more cases that are related in sort of place and time. So actually, Essex has performed reasonably well relatively in terms of the percentage of care homes that have had an outbreak, with the 3rd lowest in the region. This is where coronavirus incidents that have happened over time. So as you can see, as you'll remember only too fondly, back in February, March this year, many of the cases were school related and related to educational settings, largely through people coming back from holidays, skiing holidays and the like. From that, we went through this awful period of cases being largely related to care homes and in part related to hospitals. But more and more recently, higher proportions, as you'd expect, have been related to businesses, to workplace settings, to food outlets and restaurants. I think it is inevitable now that we'll see the greys come back, that educational settings, schools will become inevitably a strong focus for infections going forward. So I think we will see increases in schools contributing to this, and that'll all contribute together with the workplaces reopening, with the hospitality industry reopening to quite a sort of challenging situation in terms of managing this pandemic. So where are we now? We've been suppressed due to the societal action. And it has been, I haven't done anything. It's been entirely down to societal action, social distancing, people self-isolating, contacts of people who've tested positive, isolating. This is sort of likely to change now, as we're seeing, partly because of schools returning, partly because people will start to increasingly meet indoors rather than outdoors because of the weather. And basically this sort of virus, an RNA virus, will show seasonality, and we will expect to see an increased virulence and aggressiveness of this, this virus as we get into winter. There's been lots of talk about local versus central action around lockdown, and what we've seen recently has been a lot of local lockdowns. What I would say about that is it's actually been extremely effective. The increases in cases we're seeing nationally are not due to the Boltons and the Blackburns and the Darwins, because actually the local lockdowns that have been surprisingly effective, I mean, really surprisingly effective and very positively effective in terms of reducing those cases in very short order. It's the general increase in background cases in the population that's most concerning and what we're seeing. And I think probably as a result of that, the government decided to take action nationally again, although we thought there wouldn't be any central action, but as of yesterday, that's the case. I think somebody referred to the opportunities for managing this is going to be anything that's got a till in it will be protected, and schools will be protected, but other areas will face increasing pressure around lockdown, increasing restrictions. That's a bit problematic for me, because if I was asked to do a local lockdown today, and I really wanted to be most effective, I wouldn't say to family groups, you can't meet as sixes indoors. I would say we need to relook at the hospitality industry again, because most of the cases we're seeing are young adults who've caught their cases through that route. So I think there are some benefits to local action and some to the central, and I absolutely recognise the importance of keeping the economy going, and the reason why that the government have chosen to go for household groups rather than the hospitality industry. And in fairness, in a lot of the northern outbreaks, it's been those household groups that have been the main driver. Sorry, this is what might happen between September and July, and this is work from the medical Royal Colleges that you might have heard of. Please just look at the heavy blue line, because otherwise it gets really complicated. But basically what you can see is the last year's, or earlier this year's, very steep peak, which happened in March, and then the gradual reduction in cases we enjoyed over spring and into the summer. And then, as you can see, as you move from September, we start to see increases again, with an increase that really peaks in about March next year. So it starts to go up quite dramatically over Christmas, peaks in March. So this is an assumption. It's not a definite going to happen thing, but talking to the medical Royal Colleges authors who wrote this, they felt this 1.5 figure was the most likely scenario as we go forward. And there are a couple of features of this I'd like to point out. First of all, the peak is much lower than the peak we saw earlier in the year, but the area under the peak is just as big as it was earlier in the year. So that means the number of cases, the area under the peak, is going to be just as high as we saw earlier in the year. I'm hoping, because of the sterling work that's happening within care homes, that the mortality rate related to that in elder people won't be quite as bad as it was earlier in the year, but it'll still happen. And because the peak itself is much lower than the peak earlier in the year, the pressures on the NHS are probably going to be less than they were earlier, and they coped with this level. So I think they should quite easily cope with the sort of levels that they're discussing here. But you'll notice this sort of trickles right away into July next year before it starts to fall off again. The reason for that is that we've got some elements of lockdown in place at the moment, so that we won't see the very steep increase that we saw with an. However, there's a sense that the effectiveness of lockdown won't be as good as it was once you have a really stiff national thing, because this is assuming the schools remain open, that a lot of the hospitality industry, the businesses will remain open as well. So we can't shut it down quite as well. If it goes up to 1.7, then the situation becomes much, much severe. The area under this graph is twice the area under the area we saw earlier in the year, and this will result in twice as many cases of coronavirus than we saw, unfortunately, the peak of the first peak of this outbreak. People talk about flu, and people seem to be very concerned about flu. I'm going to stick my neck out and say we're not going to have any flu this year. The reason for that is that the things that stop flu are the same things that stop coronavirus, and the R values for flu are between 1 and 2, and the R value for coronavirus is 3. So if we're doing enough to push the coronavirus down below 2, we're certainly going to be pushing the level of flu infectivity and the R value for flu below a level at which it can survive within the community. And this can be evidenced from Australia, and this is data from Australia this year and last year. In fairness, Australia had a pretty grim year last year in terms of flu in 2019, but look at this year, it's just been wiped out totally. So I think there's a very unlikely that we're going to see flu, and therefore children, young people, your teachers, your staff, if they have symptoms of temperatures and cough, it's very much more likely to be coronavirus than flu as we get into the winter this year. We're doing a lot to manage it. I won't spend an awful lot of time on this, but basically communications is absolutely important. Getting people to continue to socially distance at 2 meters. 2 meters is critical. I'll talk about that shortly. And also very importantly to isolate if possible, get a test as soon as they get symptoms, because that's how we're going to stop it spreading. We have the test and trace service in place, and I'm going to talk about the maths behind that shortly. The epidemiology is really important. What we have to do is be absolutely clear where each case is, map that case, be very clear where that person got it from and where who they've given it to. And there was a lot of question a while ago about the quality of data, but I have to say, very locally, the quality of data has been very good, and I don't think data is, even though we still haven't got the full sets, is an impediment to doing what we want. Outbreaks are easy, oddly enough. When you have an outbreak, it tends to be contained. So I'd much prefer to have a big outbreak in a care home than to have a gradual increase in cases across the community where I don't know where the spread is. So the outbreaks are common, but fairly easy to manage. We have a number of powers now with the Coronavirus Action Act. We can offer direction for premises to close, for people to be excluded from premises. I'm looking at that very much alongside our environmental health officer colleagues. I have no compunctions whatsoever about issuing directions if I have to. At the moment, I think probably across Essex, we've had to threaten it about a dozen times, but the businesses have always fallen in line, and we haven't had to enact these powers as yet. This is the impact of school reopening from the UCL work on COVID cases. And again, please note that the scale is different on the first graph compared to the next two graphs. And what you see in the first graph is the 70,000 cases that we saw earlier on in the year. And then what you're looking at then is the likely scenario if you just test the cases and isolate the cases who come forward. Now, interestingly and very starkly, at the time that UCL did this work, which I think was about June, only about 11% of people who had symptoms were actually coming forward for a test and then isolating. That won't work. If you just do that, we're going to have a bigger peak than we ever had before. So then we have to look in, well, if you can contact trace those people who do have a test and do isolate themselves, how many people have to come forward and be tested, and how many people do you then have to contact trace to effectively prevent a peak? And they've got two sort of extremes of the model. If you can get 43% of cases to come forward and self-isolate against the background of about 11, then you would have to contact trace 40% of all the people who've been in contact with these 43 cases to prevent a peak. What the more realistic scenario though is this one, where you can get the the cases to come forward up to about 25%. So 1 in 4 of people who've got symptoms will get a test, isolate, and then if you can get 80% of those contacts identified and then to self-isolate, then you've got a chance of preventing it. We're not far from this on paper at the moment. So probably at the moment, around 25 to 30% of cases are coming forward, are being tested and having a go at isolation, although I think some of the isolation isn't 100%. Well, we know the isolation isn't 100%, but like 50% is better than 0. And then we are managing to contact trace 80% of that group. What we don't know is how well those 80% are then self-isolating. So I think even with the best will in the world at the moment, and we are slightly over 80%, the real drive is going to be those people who are cases who come forward and get tested and self-isolate. And I think the real shortfall at the moment is how many people are self-isolating once they've been identified. So I think this is pretty optimistic in the real world. It's doable, but I think it's quite optimistic. If we don't do this, then we'll continue to see rises in cases, potentially see the increase that I showed on the previous graph. So I won't talk about test and trace particularly, except to say the importance of prevention in this, the importance of comms within it. Our system's quite effective. We've actually been helping Norfolk. Norfolk's system couldn't cope with the number of cases they were seeing in the poultry businesses up there. So actually it's been the Essex test and trace service that's been doing most of the work there, which is great because I really wanted to test the system under pressure anyway. We have a joint service with Southend. We have great links with Public Health England. We have our own staff, both environmental health officers and communicable disease experts. And also, environmental health officer, they've been from district and council, district and boroughs have been an absolute revelation. They've been brilliant. I thought they'd have quite a peripheral, really stayed centre and really working very hard on this. And I have to commend the EHS for the great work they've been doing. Why is this here? This is the coronavirus action page, which is a local affiliated to the county council Facebook site. But I think this highlights the importance of social media, the importance of getting the messages out there. I spend a lot of time working with comms, a lot of time on the radio, the telly, really just pushing messages out in social media as much as I possibly can, because we just can't get enough of these messages. The other important message here is 2 meters. We are the only country in the UK that doesn't have 2 meters as the recommended distance. We have this rather fudged 1 meter plus, but unfortunately, nobody told the coronavirus we were changing. The reality is, if you don't go within 2 meters of somebody, you will not infect them, they will not infect you. It's still 2 meters, hasn't changed. If there's somebody near you who has the coronavirus and you are contacted by the contact tracing service, and the contact tracing service say to you, have you been within 2 meters? And the answer is no. They'll say, thank you very much for your time. Don't need to trouble you anymore. You will never be asked to socially distance if you're not within 2 meters of people, because the virus, generally speaking, the risk of it jumping more than that are pretty low. So again, comms is key, social distancing at 2 meters, encouraging people as much as possible to self-isolate and get tested, household members to isolate, and hand hygiene remains really important. Compliance is poor at the moment with self-isolation rules. Just this national survey suggests only about a third of symptomatic people, as I've said, isolate, and only 14% of them robustly and rigorously don't leave home during that time. So I'm always wondering if I need to change the message to say, if you are symptomatic, you should self-isolate. And if you really can't self-isolate the best you possibly can and minimize your contact with people the best you possibly can. Don't go within 2 meters of people, because if most people are going to leave home anyway. We just have to make sure that that when they're not leaving home, that they don't say it as an either or. They say it as, well, actually, the more that every contact we don't have helps. I'm not going to talk about that particularly. All those. So I'm going to stop now. Just take away. No, I'm not going to do that. Thank you very much for your time and attention. I'll stop there. I hope that gives you a sense of where we are, and I'm very happy to take any questions and comments. And thank you for your patience and time and listening, and thank you for the great work you're all doing.
Thank you, Mike. That's really helpful. Claire, would you like us to come back to you, or shall we try and throw some questions at Mike?
I'm very happy to be thrown at, but I mean, it's...
Well, I think between, and Alex is on the call as well. I mean, I think between Mike, Alex and myself, I mean, if there are any questions for Mike with regard to his presentation, then I'm happy for them to go first, really. And I think I saw one about why masks, if it's 2 meters. So Mike, I don't know if you want to start with that one.
So why masks? So why masks then if it's still too, well, so if you don't do 2 meters, then you have to think what you can possibly do that will mitigate. So things like screens, things like masks will reduce the spread of the virus to an extent. If you have a mask on, you're less likely to infect the person by you. The mask won't protect you, but it'll stop that. So there will be a reduced risk of getting the disease through all these mitigations. However, if you get contacted by the test and trace service, if you've been within 2 meters of somebody, whether they got a mask on or not, for any prolonged period of time, so more than about 15 minutes if it's a meter plus, or only really instantly if it's less than a meter, then you will have to self-isolate, because you will be seen at sufficient risk as to likely be at risk of having contracted the coronavirus.
And I think on that point, if I may, thank you, Mike. I think on that point, we've made it. If you can, it's really important to keep your staff 2 meters apart from each other, both inside of work, and ask them outside of work as well. You know, the likelihood is, as we go through this, as Mike said, is that you may have some of your staff who do test positive for coronavirus, however they contracted the virus. But we've already seen one school in Suffolk and actually in Essex school as well, where multiple numbers of members of staff have then been required to self-isolate through the test and trace system. So the only way you can prevent more members of staff not needing to self-isolate through test and trace is if they haven't been within they haven't maintained social distancing. And I know that's difficult all the time, but actually it's minimizing contact as much as you possibly can. So I think one of the key things to say, although we'll get into the detail, is social distancing for your children absolutely is through the bubbles, and we know that they don't need to, particularly primary age children, but for your staff, if you can, as much as possible, that's still a really important principle to try to stick to.
Thank you. Can you hear me? Oh, because I've gone onto a different screen.
Yeah, you're fine, Mike.
Yeah.
Okay, so I've pulled up all the questions. Do you want me to sort of steam through them?
Yes, please, Mike.
Okay, so thank you for joining us. Well, thank you. So if schools haven't have some schools not received testing kits then, from what I'm seeing here?
Some schools haven't received at all, although most have, but I would say a large number, if not the majority, have run out of testing.
Okay, so that's a different thing. So what I've asked Adrian to do, who sort of works for me, is to chase down the opportunity to get you some more testing kits, because I absolutely see that that's critical. So we'll look at the opportunities for that, and I probably need to work with Claire offline about that as well, about what the options and opportunities for getting those kits to you are. If we can get our hands on some, I will absolutely try and get you some testing kits. So that's one definite takeaway from us, because it's absolutely crazy that you can't get them at the moment.
The Department of Health have sent out an email today to schools to say that from the 16th of September they can access more, but it's sort of on a pro rata basis depending on the size of your school. And I think one of the things we wanted to ask about was the sort of variation across the county in terms of how tests are accessible. And one question asked this morning was if a teacher just decided to go to a test centre and ask for a test because they're a key worker, what your opinion was on that. I think that, as you know, I'm sure, people are being told to go to the Isle of Wight or Aberystwyth, can't even say it, or Aberdeen, and this whole the testing system at the moment is simply not working. So what's
Agreed.
Your opinion about key workers, Mike?
So I absolutely think it makes huge sense that teachers should be seen as key workers, but that's not a local decision. But again, it's one that I've agreed, talking to Adrian earlier, I'll bring that back to Public Health England and see what we can do about that in the NHS, because I think it makes huge sense. I think that that you are now the new front line in this. It was the care homes, now I think it's the schools. And I think that I think the penny will drop centrally very, very quickly, because I don't think what we should have done, but I don't think any of us interpreted just how hard it was going to be for you guys coming back into school. And I absolutely, appreciate everything you're doing, and my heart goes out to you, because it has been very difficult. I think that teachers should absolutely be seen as key workers, and I'll push centrally to try and make that happen. As it happens, I'm seeing Chris Wishy tomorrow, but I'm not really allowed to talk about this, about coronavirus, but I will certainly push as hard as I can to get this changed and sorted.
So I think
I can't promise.
Sorry, Mike, I think we've agreed a twin strategy. I spoke to Adrian earlier, Mike, that everything that Mike and Adrian Coggins pushed through the Department for Health, I'll also push through the Department for Education at the same time, so that they are pushed through. But I think a key game changer will be exactly that, teachers being regarded as key workers for testing. So I think that's something that we will certainly take forward as a matter of course.
Yeah.
And we'll also try and get you better access to the tests.
But having said that, Mike, I think the opposite is also a concern, that 111, the default position when anybody phones at the moment, if you phone with an ingrowing toenail, they tend to say get a COVID test. Now, that may or may not be a good idea, but it is absolutely stopping schools from operating, because parents are being told, take your child out of school. That child may be better in a couple of days' time. What's your advice about, and in the meantime, they haven't managed to get a test anyway. So we're seeing many, many children out of school who are just having sort of very minor symptoms of something else, but have been told to get a test, and so are being kept out of school.
So this isn't rocket science. If they've got a temperature, and less likely in children, but if they've lost the sense of taste, smell, then they are assumed to have coronavirus until proven otherwise. If they've got a runny nose or a sore throat, they are not. I just think we have to be really, really clear about it. And NHS 111 may not be helping on this. If a GP says, I think that's a bit different, because they probably may have taken a more considered view of it. But I think children who have got temperatures, then the risk is that they may have coronavirus. So I think it is important that those children do get tested. Absolutely, as well. One of the problems at the moment is a lot of people getting tested who don't need testing, and that is actually impacting on others' abilities who do need it to get the test. So we shouldn't be getting people to be tested who don't need testing.
Thank you, Mike. There was also a subject.
Can I go to the next one? Can I get to the next one?
Sorry, Mike. You go on.
The next one is we've been unable to get tests for teachers who have children at home with temperatures. They're sure it's something other than COVID. Should they be off for 14 days while they await a test, even if the child recovers? So unfortunately, that would be the position. First of all, they shouldn't have to. They shouldn't have to wait. And I think this is an important one as well. If teachers are key workers, how do we get their children to get the tests quickly? So it's not the teachers who want the tests, it's the children who want the tests. So again, if we can get you some tests kits to the school, then it's not unreasonable for you to use them on teachers' children who are at home. Otherwise, you'll lose that teacher for 14 days, potentially. So I think that I think again that it is really important that the children and teachers get access to testing very quickly. I don't think the question is saying, can we test the teacher? Because you wouldn't test the teacher. There's no point in doing that whatsoever. You test the person who's got the symptoms. But again, we should be a way of making sure that those tests have come through quicker. They suggest that in about 2 weeks the system should be getting better, but I heard that 2 weeks ago, to be honest with you. You don't send home a bubble while waiting. The current view, I understand, is we don't send home a bubble while we're waiting test results.
No, that's correct, and we've issued guidance to that effect. It was in the early days that was the case in terms of the wider opening, but with the full opening now, you only need to send a bubble home if you have a positive test, not if you send a child home who's symptomatic. And I think that's key. So that is the main difference, and that's what we should be doing. And the guidance that we send about what to do if you have a positive test confirms that.
So,
I haven't got any...
Sorry, Mike, before we go on, can we just ask the question then, are you both happy for Essex guidance that comes out to schools, not to override everyone else's guidance, but the problem is that often, not always DFE, but quite often the NHS guidance contradicts the guidance that we've been given by Essex and sometimes DFE. So can we be sure that the Essex guidance that comes out has taken all of that guidance into account? Because the problem that head teachers have is that parents are coming in holding all sorts of other bits of guidance and saying, yes, but. And this is really making it impossible for head teachers to make decisions.
Well, my view is yes, we have produced that guidance with Mike and his team, so it's not been done in isolation. That is consistent with the DFE guidance, to be fair, around you should only send a bubble home if you have a positive test. So that is consistent with the DFE guidance. But certainly, I think that's where we're coming to in terms of, and it's a bit like where we were, Pam, during the start of the lockdown, to be honest with you. We were making sense of the DfE guidance for you if it didn't make sense, and we'll continue to do that working with Mike and his team, because you guys have to remain open, and that's the most important thing.
I think the definitive guidance for me is the DH guidance rather than the DfE guidance. And they do pretty much align 99% of the time. But my advice, if you're ever concerned, either contact us, because we can get very, very quickly, or check the DH guidance, which I think is usually very clear. Not always, but usually very clear. What are your thoughts on consultation around unlicensed vaccines? To be honest with you, I've not really kept up on this. I think there will be a vaccine probably sometime next year. So I don't actually, I'm not going to answer that because I don't really have any strong thoughts on consultation around unlicensed vaccines, sorry. We talked about masks. Masks help, but they're not a substitute for 2 meters. Please use the 2 meters if you can in your staff rooms, in between your staff. It's really important. Climbing frames on school grounds, can children use them? Can different pods use them at different times? Children go to, well, actually, you're right, children can go to the local parks, can't they? So I think that I think it's important to try and wash them down, clean them down, get some disinfectant on them as much as you can. But I would say that children could use them, yes. I think the risks from that are quite small. Children-to-children spread isn't very common. It isn't quite as severe as through other groups. So I would be reasonably content for children to use climbing frames. Parents choose to keep children at home because they have symptoms. Should the sibling with no symptoms be kept off too? Yes, they should. If the child's got symptoms and is a potential case, then the current guidance is that household contacts would be required to self-isolate until the person, the child or the grown-up, has a test. So yes, they would have to keep the sibling at home with no symptoms.
So Mike, could you just be very clear on that? You've just said that they should be kept off and other members of the household should be kept off until the child has had a negative test.
Correct.
That is certainly one of the places that there is confusion and contradiction in the guidance, because some of the guidance says everybody else in the household should hang on for another 10 days in case they show symptoms. So can you just clarify which one that is? Because
okay, so I agree, and this one's one that has changed. So my understanding is if somebody has symptoms, then they need to be tested. If they're negative, then that's fine. Everyone can go back. While they're being tested, while there's a risk, while it's different from the bubbles in the school. In the bubbles in the school, the rest of the children can carry on going to school. In the household, they can't. In the household, the assumption is, because spread's easier in household, that the whole household need to isolate until there's been a negative test. So if it's a negative test and everyone comes back, it's not an issue. The only person who needs to be tested is the person with the symptoms. You don't test the sibling, you don't test the parents. And it's entirely driven by the symptoms. So if the child has symptoms and comes back positive, then the child needs to isolate from 10 days from the start of those symptoms. And the family need to isolate for 14 days from the start of the symptoms, because they may be incubating it still, so it may go on for longer. Does that make sense?
that's really helpful, because it is contradictory in some of the guidance, and we've had quite a lot of questions about that. So
Mike, can I come in there quickly, please? Just because we have had quite a lot of queries on this to the school comms inbox and conversations that I've had with schools. I think it'd be a really good question to ask if you could clarify the difference between what you've just explained as close contacts and the difference between contacts of contacts. So we get a lot of questions around when a member of a household has tested positive, whether that means we need to close a whole bubble because they're contact of a contact.
No. So contact of a contact is irrelevant. You've got to be the contact of a case. So the only people who get tested are cases, and the only people who get isolated are contacts of cases. That is it. It's straightforward as that.
Right, thank you.
But this bit about whether or not you isolate before or after the test has been shown in some of the symptoms, that's the one that's been, I think, the most difficult, the most complicated. I'm clear that the position at the moment is if you have symptoms, the family have to isolate until it's been demonstrated that it's a negative. So we have mentions about 2 meters for 7 to 11, i.e. white. adults and not children, given the rates. Because it's, I mean, the answer is it's almost impossible to do 2 meters from 7 to 11s. So that's why the bubble's kind of been put in place instead. Ideally, you would want to do 2 meters, but I just don't think it's actually feasible or possible. With children, 30 children face towards a teacher, does this not increase the risk of them contracting COVID? Yes, but the teacher should try to be 2 meters away if possible. But yes, it would, yes. And teachers certainly should not be shouting, because shouting will increase the risk of transmission as well. Staff member's child attends a nursery where another child has symptoms. Should our staff members still come to work? Yes. So this is the same question again, isn't it? This is the contact of a contact. So another child has symptoms at the nursery, but not the staff member's child. Therefore, the staff member's child is a well, first of all, if the child tests positive, that child is a contact. But the staff member is a contact of a contact, so they don't have to worry. So the staff member can certainly go to work in terms of risk of coronavirus. The issue about childcare issues is not one for me to answer. I don't know if somebody else is there to answer it. So 2 meters is still better than one. Oh God, 2 meters is a million times better than 1 plus a mask. Well, not a million times better. That was an exaggeration. It's at least 2 times and probably several times better than 1 plus a mask. So more than 2 meters is definitely better and should be exercised as much as possible, mask or no mask. And if you're more than 2 meters, you probably don't need a mask. Is there any advice for children who are presenting with colds but also have a cough or temperature? That's a really good one. That is a really good one. I think if they've got colds, they've probably just got a cold virus. But you know what? I'm going to take that one away and talk to Public Health England about that one, because that is quite a good question. I'll take that one away because I think that is a very intelligent question, and I'd need to think about that one. If they got the colds and the cough and temperature.
And I know that quite a lot of schools, quite a lot of head teachers are being given grief from other parents for allowing any child displaying any cold symptoms, never mind a temperature, to allow them into school. And again, I think head teachers need really, really clear statements and guidance so that
yes.
they can present that to parents and say, this is what we've been told is safe. Because again, you know, as we all know, we have the extreme of some parents who want to send their child in come what may, and the opposite of parents who don't want their child near anyone else. So head teachers need very, very clear guidance around that, and more so as the term goes on and we start seeing winter illnesses.
Absolutely, and all that we can do is the best we can do. So wherever, if we go one way, we're going to be excluding a whole bunch of people who've just got colds. If we do it the other way, we're going to be admitting people who've got coronavirus and missing them. So I think this is going to be a really difficult one, but I'll check up on that one.
And Mike, there was a question in the chat about sickness and diarrhea, whether that should be added to the list of COVID symptoms. I mean, I think anything can be, frankly, but
but you can't add anything. We should stick with the nationally recognised symptoms, and that's it. No further than that for the time being, unless the evidence starts to show that the other stuff is of sufficient merit and to use it. So my sense would be, the issue with this child is they've got a cough or a temperature as well as the cold. But I wouldn't start adding in other different potential symptoms as well. I think but I do need to check this one out. Just also in a text conversation with all my cluster schools, and they can't get tests. Yeah, even teachers. Yeah, I agree. Can they give the few tests we have in school to teachers? Yeah, I don't see. Do you know why not? Why not? Yes, I mean, your schools are going to grind to a halt unless they've got teachers. So I would suggest, yes, we could. That's a sensible use of those tests. But we'll try and get you some more tests. Children with asthma as approach winter, how do you manage this with coughs, which can be persistent and ongoing? Advice is a cough, they get tested. How does it work for children who often get a temperature at the same time due to coughing? Well, children with asthma shouldn't necessarily get a temperature just because they've got a cough, but that doesn't matter because the cough in itself may be related to that. I think it's going to be difficult. I think that it is going to be difficult to detect which are which. And that may have to be on a case-by-case basis with discussion with the GPs, with a sense from the parents about whether that cough is like their asthma cough or another cough, because you're right, it could be persistent and ongoing, and they can't just keep testing them. So again, that's going to be a tricky one, and one that I would endeavour to get you more advice on. What's the temperature for a child? Yeah, I think it is. Yeah, yes. It's not for us and for you to necessarily take the temperatures. I think that the temperature thing, children who are hot look toxic, children who are hot look red, they feel hot to the touch. So it's not simply about you getting what the temperature is, it's kind of also whether or not they actually feel hot, which is quite common. Do children not need testing if they have continuous coughs? Do you know, I think that's what I'll take away and I'll get you definitive answers on the asthma and the coughs and the colds, I think, because that is quite difficult. Now, croup sounds totally different than a cough. Croup will sound different, and I would think you could distinguish that, and they shouldn't have to isolate, and they should come in. What about social distancing from children or children from staff? I try and maintain the social distancing as much as you possibly can. Have I made you jump here and lost some questions? Sorry, I would. I try and social distance the children from the staff as much as possible. Older children, your primaries, aren't you? I think social distancing children to children is recognised to be very difficult, and that's why you've got the bubbles in place. So I would certainly try and staff social distance rather than the children. School has a positive result in a sixth form bubble. They've been guided not to send the bubble home. Oh, by who?
Because they would have been socially distancing, Mike, those older children from each other.
Oh, okay, okay. Right, okay. So if they have appropriately, is this advice from Public Health England though?
Is Claire there? Can we ask Claire to jump in and?
Yeah.
No, Claire,
yes.
The question, Clare
From Clare
what's the
Kershaw.
question if she's there? Claire, are you there? Can you unmute yourself?
Yeah, no, I'm bringing a question really from Mesh. Obviously, the advice this morning was that the bubble. We were obviously made aware that the sixth form there was a positive test, and we were all waiting for it. We know it's going to happen. It's bound to happen. Yeah. And it's then what we do about it. We were surprised to hear that the bubble wasn't being sent home, and realistically you cannot socially distance sixth form classes. It's just not possible.
Who gave you the advice, Claire?
To be honest with you, I know that the head was working with, he was following the guidance and speaking to people externally. Maybe that, to be fair, I'd have to go back to Paul and check that guidance hadn't changed. But certainly when he communicated this morning, he suggested that the bubble hadn't had to go home.
Maybe. Sorry, can I just say sorry, because my husband works at the school. Actually, the advice was given to Paul by Public Health England's consultant last night. I don't know whether it's changed today, but it was Public Health England.
Right, okay. I honestly don't know. I just know that, through our communications today that I suppose several of the other mesh schools were concerned that, right, so if that's the case, my understanding had been if you have a positive test in a bubble, that bubble goes home. But is that to do with being one or more linked into your guidance on care homes? That if you have one, that's an outbreak?
No, it wouldn't be. Not in this instance. What I would like to do, please, if somebody could email me the name of the school, and I'll bring it up with Public Health England. And
would you mind if I speak to Paul? I'll speak to the head myself this evening, and I'll explain the questions I've asked, and then I'll get his details to you. Is that okay?
Yeah, I mean, really, what I do need, I know the details. I need to know the details because I do need to go back to Public Health England on this one and understand why they're taking that approach. It may be, as somebody said earlier, that the sixth form they believe are effectively social distancing at 2 meters.
Right. I'd be very. Don't get me wrong. I mean, my sixth form, we've got them in a bubble. and some classes are quite small, therefore they're being seated as far away from each other as possible. We're following all the same rules, but certainly at break time and lunchtime, you know, they are not socially distanced completely, and in most classes where there's, you know, a number in a room, they can't be socially distanced because we wouldn't be able to put those processes in place. Wish we could.
No, and frankly, anyone who's seen children walking home from a secondary school once they're outside the school gates will know that the idea that all 11 to 18-year-olds are socially distancing is just absolute, you know, it's not happening. So
can I just say, I think at the moment we're kind of speculating a bit. Let's find out.
Yeah, I'll get the info. I put that question in just because I thought, well, I want to know the answer, because if it happens at our school, and there's every chance it will do. Let me go back to Paul, and I'll make that link if that's okay.
So before we close off that one, just because a lot of people are going to leave this meeting wondering about it, when the school contacts Public Health England, they will be asked a load of questions to ascertain the situation entirely. It's not a black and white. There's been a case, and so you need to isolate the child could have been in school for a few days, all those kind of things. So I just didn't want people to leave today thinking that there was an issue there, and we need to look into it a bit further.
Yes. And I think you're right. I mean, it is individual circumstances, but broadly, you could expect that if there was a positive test in a bubble, and the young people in the bubble have not been able to socially distance, you would expect the whole bubble to be going home.
Yeah, one case is enough to send the whole bubble home. Yes.
That's great. Thank you.
Thank you. What's the chance of making face coverings for parents on school sites mandatory, please? I think it'd be good practice. I don't know if it'd be mandatory or not, to be honest. I don't think it's, I think if you can, what you really need to do is make sure they don't go within 2 meters of anybody if you possibly can. Is this like when they come to pick up the children, or what were you thinking?
So they come, I've got nearly 400 children at my school. Can you hear me?
Yes.
Yeah. And the parents come on site. We've got 4 entrances and exits, but they come on site, they stand chatting to each other. I've asked them to wear face coverings. I wear them, my staff wears them when they're outside, or when they're near the parents. Set a good example. But they're just standing together, chatting, and some are wearing them. Numerous letters out. I don't really know what else to do, but they just using 2 meter rules or anything. And then, of course, at the end of the day, they go off to the playground, which at the playing fields opposite my school, and then all the children playing together. So all my bubbles are mixed in at the end of the day on the playing fields and having fun. And all day I've kept every single class separate on my playground, in my classrooms. Nobody's allowed to be near, and my staff are all wearing face masks when they near each other. And then they go off and they're all playing together with their parents over there as well, having fun. And
yeah,
if it was mandatory, it would help really.
Yeah, I don't think it'll be made mandatory, and particularly a lot of what the issue is, but it's not actually on the school grounds, it's just outside the school grounds, things like this. So I think
it's on the school grounds as well, but it's,
yeah.
I mean, some are really trying and being really good, but hard say 50% are not.
I think all you can do is push as far as possible for people to take it seriously. The mask isn't as important as the 2 meters as well. So if you could try and do something around socially distance, that would be better effect. It's good to know that some are complying well. Students are not required to wear masks except
no, not my students, not my children. I'm just
no. It was another letter. It's another one further down.
Oh, sorry. Okay, thank you.
Are antibody tests back on the market, and are they accurate? Antibody tests are on the market. Antibody tests are accurate. That's the good news. The bad news is that they predict whether you've had it very, very accurately. They don't predict whether you're immune to it. So the difficulty at the moment is, even if you've been shown to have positive antibodies, it doesn't necessarily mean you won't get it again, and it doesn't necessarily mean you won't give it to somebody else. So they're back on the market, they're accurate, but they're neither use nor ornament at the moment, I'm afraid, until there's been a strong demonstration that having the antibodies equates to not getting the disease again. How often should toilet facilities be cleaned? I don't know. I don't know that one. I don't know that one. There are others probably better placed to look at that. How far back do we trace? We contact trace 2 days back, 2 days before the appearance of symptoms. ESET question. And PP, we just need clear diet.
I'll take that one, Mike. Diane, we're discussing that one daily, Diane. So just to let you know that myself and Philippa and Adrian in Mike's team are onto that one. So leave that one with us. We're trying to make progress on it, Diane.
Thank you, Claire, very much. Thank you. I'll feed that back.
I am aware it's a real issue at the moment. What's appropriate and how we can do it. Bridget, I'd never heard you, so I don't know. So that's an interesting one, isn't it? Certainly in churches now, it's absolutely not recommended. Singing will actually transfer the virus quite quickly and more widely. I think if it's just your bubble, it won't make any difference because that bubble are kind of going to be exposed anyway. I probably wouldn't encourage it, to be honest. I wouldn't encourage singing at the moment. The COVID symptoms study up list differs. Yeah, so I think that, yeah, I think somehow we've got to draw the line and say what are the symptoms that are quite clear and we can associate with it. But I mean, fatigue's really vague, isn't it? And a lot of these symptoms are probably symptoms that have been detected after the event from the positive tests rather than directing us towards the why to have the tests in the first place. So I don't think we should start making our own list of symptoms. I do appreciate we're probably missing some cases, but I think it's important that we capture those that we are expected to capture through the fevers and coughs. If a child is in 2 bubbles at school, such as class bubble and wraparound care bubble, would both need? Yes, they would. If that child is positive, yeah, they would both have to, because the child's in both bubbles. Is it safe for early years children to sit across from each other in groups rather than facing forwards in rows? It probably doesn't make a huge difference. I think rows is ideal, but actually for small children who are spending a lot of the time talking together, playing together, running together, shouting in the playground, it's probably not and are in a bubble anyway, it probably isn't hugely important, I wouldn't have thought. It is slightly less safe, but not much in it, I wouldn't have thought, really. What would you want a school to do, not do, whilst waiting for advice from public health following a positive case? So how long, don't you hear from, where do you hear from about the positive case? Won't you hear from public health straight away?
So, Mike, we have had a few instances of schools phoning the local helpline and then being advised that they'd get a call back, and that not happening for over 24 hours. So in the interim period, they're chasing up advice on what to do about that bubble. Okay, so I think the sensible thing to do is to exclude if you know for sure 100% it's a positive case, I would suggest you exclude the bubble while you're waiting for the advice, because generally speaking, the advice will be to exclude the bubble. That's why you have the bubble. Are year group bubbles still an option? If so, we could be a whole school bubble with less than 120 students on the roll. Well, they're an option, but your whole school will go down if you have one case. And that's what we're trying to prevent, really. I guess. So I think it's an option, but I wouldn't think it would be a great option, really. Can you bring in their own reading book from home? Yes. If a bubble has a positive confirmed case, do siblings not in the bubble have to self-isolate? So yeah. So it is the contact thing. So the siblings of the case obviously have to self-isolate, but back to the contacts of the contacts, the siblings of the contacts within the bubble do not have to self-isolate. So the only people who've been in direct contact with the case have to self-isolate. So not the siblings of the people in the bubble, other than the case, but the siblings of the case have to self-isolate. Is that straight? Is that okay?
Do we contact only with positive, or if an individual has symptoms? So if the individual has symptoms, then the individual should be excluded and needs to have a test, but you only need to contact public health if they got positive tests, because at the moment, most tests are still coming back negative in children. And I can't see that changing really, not for a long time. So no, only contact Public Health England with a definite positive test. All our parents that were masks on site are good. Head teacher with positive test in year 13 is have to be contacted. Oh, it's a year 13, not a year 6.
No, it was sixth form, so yeah, year 12 or 13.
Oh, they would. Oh no, that'd be fine. No, they wouldn't. I'm sure they can appropriately. I thought when year 6, I thought you meant like they were 11 or something. So no, I think that's a different matter. So secondary schools don't really have bubbles.
Sorry, I've just come in there again. So it was me that put the question on. So if you've got it, we have year group bubbles, and all the secondary schools that I'm working with are working really hard to keep year groups isolated from all the other year groups. So sixth form would be a bubble in itself. So if, for example, take another year, say we had a positive case in year 8 with a year 8 student, would the whole of year 8 have to go home because we treat them as a bubble?
So I think that case probably would depend on public health advice. We'll find out what's going on, but I'm more content if it's a sixth form that they've probably spoken to them and being clear to how close they've been to people for a particular period of time. So
okay,
I will follow that up, but I'm actually less worried about it than I was.
Okay.
So Mike, can I come in there?
That's helpful, thank you.
Can I come in there, Claire, to help out as well? So absolutely, it's to do with the contacts and the test and trace. So even though you've got year group bubbles, my understanding is that is to help you then to identify the contacts much more easily, because obviously children are moving across the whole school. You just wouldn't know who the contacts are and who they're not. But I do think Public Health England, when talking to you, would then talk with you about whether the whole year group needed to self-isolate, or whether you had whether the positive case contacts were not the whole year group. Does that make sense, Claire?
Yeah, that's really clear. That's really helpful. I think when we were talking about it this morning, we were all like, okay, so where do we go? So that's very helpful.
Yeah.
Thank you. I'll be able to share that. Thank you.
So I kind of went offline a bit then, just to sort of make a note of that Mr. Farmer's address, and now I'm struggling to see the questions again. Right, with same issue, we could say the parents has now asked them all to wear masks. Yep. How many known cases are there of people getting the virus more than once? So I don't think there are many cases. I think there are a couple of recorded possible cases in the literature, but I don't think there've been very many, but I think it is certainly a recognised possibility at the moment. We're entering school visit season. Should families' visits be avoided? Yeah, I think they should. I think I would. I think it would, where you can do these things by Zoom, why wouldn't you? My son's school do some meetings over Zoom and that. I think that's okay. Thank you, Sandra. You're very welcome. What's the plan going forward? Temperatures drop below the minimum level in classrooms due to doors, window being a ventilated room. Is it just extra jumpers and turn the heating on? So I think you have to take a judgment on that, really. I don't really think we're effectively ventilating the rooms in the depths of winter. I'll look into that in more detail, but I think sensibly it would not be possible, would it? So I think we'll have to start closing doors and windows. COVID early outbreak management states as step 1 that when you have a possible confirmed case informed by track or trace or someone who thinks they're possible symptoms. If so, no, I think the case. I think it's only if you've got a definite positive that you need to trouble Public Health England, because they're not going to suggest anything if it's only a possible case. So I think it's got to be a confirmed case before you do anything about it. I don't know what proof. I suppose the proof they would have would probably be a text, wouldn't it? So you could ask them to see the text. Yeah. Is this what is this? I don't know what sure the context for that is.
So at the moment, the DfE guidance says that schools should not request verification of a negative test result. They should just allow particularly children to come back to school. And some schools are concerned that parents are not accessing testing and saying, oh yeah, my child's had a negative test result.
I think this is an example where Essex has gone beyond the DfE guidance, actually, isn't it, Alex? Because I think we have tried to answer this, and I don't think it's unreasonable for you to ask for evidence of a negative test if a child's had to get tested and it's negative. You know, I think that's great. The parent wants the child back if they have had a text, just to prove that. I personally don't think it's unreasonable for you to ask for that in terms of just the confidence levels of allowing their child back.
Yeah,
I think that's entirely appropriate and reasonable. No, an Ofsted inspector wouldn't need to wear PPE, I wouldn't have thought. I also saw parents show results. Yeah, that's great. Same here. Yeah, good. Is that then?
I think so, Mike, in terms of the questions and the feedback we're getting is people have found that very, very useful. One of the things I've been asked as well is, can we try, so I'm glad you're recording this, Pam, can we try, Alex, to add this to the guidance, or maybe produce some new guidance about symptoms and contacts of contacts, just so you've got records of all of that, certainly once Mike's gone back and given us the advice of the systems. So we might end up with some annexes to the what to do with the positive test guidance, but also about the symptoms, testing, contacts of contacts. So give us a few days to do that, but we will try from the from this session to put that into some really digestible and easy, user-friendly guidance that you can refer to.
And Mike, could I ask on behalf of everyone, would you be prepared to come back to us in a month, 6 weeks or so, and do a similar webcast? Because I think this has been really helpful, and as the circumstances change, both in relation to COVID, but also when we see how things are going in Essex, and as we get closer to winter, I think it'd be really, really helpful. I think the number of people who've been able to stay on to the end is testament to how helpful that is. So, you know,
can I thank you for all you're doing? This is really hard stuff. We're all still learning together. Some of it is kind of a bit busked. But I think I've really found this very, very helpful to understand the issues that you're facing with day in, day out. And it's only those nuances and complexities that will help us learn and help us to understand what's going on. I absolutely apologise for nothing to do with me, but the NHS's problems with testing and access to testing at the moment. We'll see what we can do, Claire and I working together, to find some sort of workarounds for teachers locally, and to whether that's getting tests to the schools or somehow sneaking you in the back door or something, but we'll work out something somehow. But thank you very much for your time and attendance and attention this afternoon.
Yeah, and thank you, Claire, as well for joining us, and we will obviously be sending you many, many, many more questions in the next few days. So.
And please do keep them coming. You know, it's all you can do. Don't try and answer them if you can't. Just keep them coming. We're in touch with Mike's team daily, hourly, probably half hourly as well. So please do keep them coming, because then what we'll do is we'll produce the FAQ. So the other thing by sending the questions in is that they will then come out in very clear FAQs, exactly the way we've been operating all the way through. And we will keep them all highlighting, so that you're all learning from each other as well. But you know, you haven't even been open for some of you for a full week. So, you know, once we get a bit more confident with all of this, I think it will help. And once parents get a bit more confident with all of this, I think it will always also help as well in terms of what's going on. But you know, you have been doing a tremendous job for some of you open just over a week, for some of you not yet quite a week. And I know what a challenging week it has been for many people, given the degree of questions that are coming through. But I think as we get into it, you know, I think we'll all work together on this one, as we have done all the way through.
Thank you. Good. Well, I'm going to end the meeting for all. So many thanks to everyone, and we will make sure that the recording is available for head teachers. So have a very, very good evening, everyone, and we'll be in touch very soon.
Thank you, Pam. Thank you,
Thank
Mike,
you for
Claire,
organising
everyone.
this as well, Pam. Thank you.
Yeah.